everyone, welcome today on our channel Nutri Healthy Lifestyle. So today we'll be rounding up on our topic diabetes and goal of treatments for diabetes generally. In my previous video I talked about type 1 and insulin with the goal of treatment, and I'll be doing the same thing today as well. But before we go on, let me quickly mention two types of diabetes that we haven't talked about yet, and that is gestational diabetes and medication-induced diabetes. So let's start with medication-induced diabetes. So medication can cause your blood sugar to go up and cause an increase in your blood sugar. Medications like some statin medication, beta blocker, some antipsychotic medication, some statin medication, some thiazide diuretic medication, and some retroviral medication can cause your blood sugar to spike. So if you are currently taking such medication, I would advise you to speak with your doctor or your nurse practitioner, or you look that medication up yourself on the system to see if that would trigger your blood sugar to go up. Now, if that would happen, I would advise you continue to check your blood sugar every day. You check it in the morning and at night, or you check it once daily as soon as you wake up, so that if there is a variance in your number, you speak with your doctor and your doctor follow up with the line of treatment with you. And the other type of diabetes is gestational diabetes. That usually happens to pregnant women, and there is actually no symptoms, and that's why it's always advisable to go for your prenatal care and also follow up with postnatal care. Gestational diabetes is usually detected in the third stage of pregnancy, that's the third trimester. When you go for your appointment or your clinic, your doctor runs various of lab work on you, including glucose tolerance tests. So with the glucose tolerance test, your doctor or your gynecologist might be able to establish if you are going to suffer from this disease, and your doctor continue to monitor you and the baby. By the way, gestational diabetic baby are very big. So as soon as the baby is giving birth, the doctor continues to monitor the blood glucose, and they administer some glucose for the baby so the baby doesn't go hypoglycemic, and also continue to monitor the mothers. Please follow up with your clinic after birth. And that will be it on gestational diabetes and medication-induced diabetes. So today our focus is on type 2 diabetes, goal of treatment, and other advices that I'll be talking about. We all know that the cause of type 2 diabetic is because your body is not producing enough insulin, or your body is producing enough insulin, just that your body is not responding to it as it should. So that triggers your blood glucose, and there is no how you're going to know that, because they mostly don't have symptoms until it gets severe. So how do we know that, or how can we quickly detect it? You have to go for your physicals every year, or you check your blood sugar by yourself every day, know your numbers, and as soon as you start getting disturbed with your numbers, you need to pick up your phone and talk to your doctor, talk to your nurse practitioner, or talk to your case manager, and then your doctor will follow up with you. What are the predisposing factors for type 2 diabetics, apart from hereditary, apart from some genetics, some known factors and unknown factors? It has also been established that unhealthy lifestyle, excess weight gain, and lack of exercise is one of the reasons why most people develop type 2 diabetes. And your doctor will advise you when you go for your checkup with your doctor. And according to American Diabetic Association, in order for you to have an effective treatment of diabetes type 2, you have to cut down 15% of your weight in order to have a very good management of diabetes. Your doctor will advise you to cut down your weight, exercise more, and watch what you eat. So for nutritional benefit, I would advise when you are eating your food, if you are pre-diabetic, because when you are pre-diabetic, you can reverse diabetes. Yes, you can at that stage, because at that stage, if you start cutting down all those things I talked about, you are able to reverse back to your normal state without having to progress into type 2 diabetes. So I would advise your whole plate, half of it should be vegetables. healthy vegetables, and the remaining half you half it into two. Your first half portion will be your protein. Now it can be plant-based protein and it can be animal-based protein, and your remaining half will be your complex carbohydrates. I will do another video to talk about diabetic plates. So please follow up with your doctor's appointment, and if after 3 months or during your pre-diabetic state you're still not able to be fully compliant with your care of your pre-diabetic status, your doctor would do another A1C test for you after 3 months, and if your numbers are not trending down, your doctor will add some medications for you, along with you still trying to work off on your weight and your diet and exercise. And if that is still not working, I'm afraid your doctor might have to put you on insulin. And so when you're on insulin, it's not bad. I mean, you can still manage with what you're eating and with your medication. But once you're on insulin, please refer to my first video on type 1 diabetes and insulin. Follow up with your glucose check and your insulin administration, and follow up with your diabetic clinic, so that your diabetic nurse or your practitioner will put you through on how to check your insulin and how to administer your insulin all by yourself. I'll be stopping today on this topic, and if you have any clarification, please feel free to send me a message or send me a DM so that we can talk together and iron out your clarification on type 2 diabetes. On today, I will say thank you for joining us today. Please, before you leave, remember to click like and share my videos, and subscribe to my YouTube channel for more information on health tips. Thank you so much for joining, and have a good day. God bless you. Bye.